Governor, let's start with the most pressing issue of our time on many levels, so many aspects to COVID-19. What has been the biggest lesson you have learned to date as we tape this program on the 23rd of September, 19 months in, the biggest lesson about leadership and, frankly, about being governor?
Yeah, again, it's good to be with you. And the loss in New Jersey has been overwhelming. Over 27,000 losses of life, an awful first wave, a tough second wave. We're still in the fight as we sit here. It's not as bad as it was by a long shot, but it's not as good as it was a few months ago. I wouldn't trade our hand with any other American state as I sit here in terms of the level of vaccination. We're among the most vaccinated. We've got the smallest number of ICU beds occupied by COVID patients of any state in America. Those are good facts, as tough as it still is. I think the biggest lesson in leadership, Steve, is to get a balance right. And I've said this before, but Churchill, early World War II, when the Germans had overrun the continent and the Americans were not yet in the war, if I could channel a fingernail of Churchill, it would be balancing, telling folks the absolute truth, even if that truth really hurts. Make sure that they understand the facts, but at the same time, giving them a realistic path forward of hope, of optimism. If we do X and Y together, this is the path that will get us out of this really dark spot in this dark moment. And that, to me, is that balance has got to be there. You got to give people hope, but you got to tell them the truth, even if it hurts.
In that spirit, Governor, I asked you this about, I think it's 6 or 7 months into the pandemic, and I want to return to it because you know more now. We know more now. But the decision to send patients who were in nursing homes, got COVID, were in hospitals, back into those nursing homes. Approximately 8,000 people, a little fewer than that, but every life matters. 8,000 people who went back into those nursing homes died. Question. Do you regret in any way the decision to send those patients back into nursing homes without the nursing homes, because you told me last time the nursing homes needed to do certain things, they may not have done them. Do you regret that, A, and B, what do you take from that horrific experience, mostly for those families?
Yeah, I mean, the loss, the pandemic in general, but within the pandemic, the tragic loss early on, especially in long-term care, was the tragedy within the tragedy. I have to roll the tape back, though, Steve, so forgive me for challenging a little bit of the premise of the question. A couple of things. Number one, they're not patients. Remember, this is their home. They're residents in these places. And we have to remember that they were returning home. Secondly, we were crystal clear in my own voice, in the executive orders from myself and or Judy Persicelli about the protocols for anybody returning to their residence who had been positive for COVID. They must be separated by floor, wing, or better yet, building, and the staff that serve them had also needed to be separated. So you did not mix populations. We also said, and by the way, if you can't do what we've just asked you to do, call us and we'll help you do that in some other residence until this thing passes. By the way, very few folks ended up calling us. Did operators behave badly? Potentially, yes, and they will be dealt with, or they have been dealt with. But our instructions and parameters were crystal clear.
So I just want to be clear before we leave this. The Department of Health has jurisdiction over Judy Persicelli, the Commissioner of Health, who's joined us many times. They had jurisdiction and regulatory authority over those nursing homes, correct?
Well, there's a number of different elements of government. You've got Human Services plays a role, the Attorney General, which has investigated, plays a role. The Department of Health, in fact, has fined a number of operators, but it's a number of different areas in the government.
I just want to understand this. Are you saying that you and your administration took the nursing homes at their word that they were going to separate people and do what they needed to do? Because clearly it didn't happen to the degree it should have, because New York and New Jersey had the highest number of people die in nursing homes during the particularly early months of COVID.
Yeah, by the way, that ultimately happened almost everywhere, Steve, sadly. It was not, at the end of the day, it wasn't just New Jersey and New York. The way that you deal with this industry, which is the normal process, you make them attest. You request an attestation that they affirmatively understand the rules of the road and commit to abiding by them. And that's the basis upon which now are there spot inspections? You betcha. But that's the basis. They agree affirmatively that they understand your executive orders and that they commit to abiding by them.
You know, Governor, as we do this program, there are commercials out there, and again, we refer you to public broadcasting and other respectable sources to find the accurate information that you need to know to vote on November the 2nd. So commercials are what they are. But some of the commercials out there that your opponent, Jack Ciattarelli, is putting out there, one of them that really is interesting quotes you in saying, I'm not sure what the context was, Governor, but if I have this wrong, you'll tell me. You've never been shy about that. He keeps saying this over and over again that you said, and there's a spot of you saying that if you are a one-issue voter, that issue is taxes, we are probably not the state for you. What does that mean? Because his interpretation of it is that you don't care about the taxes people pay.
Yeah, which obviously is not the case, and that was taken out of context. I will say this, if you're a one-issue voter and your issue is taxes, I can tell you right now, he's not your guy unless you're a millionaire or the CEO of a big corporation. The point is this, we inherited an affordability crisis in this state, among other crises. And from moment one, we have been chopping away at that. And we have had a laser focused, especially overwhelmingly, on the middle class and those who dream, as I did in my family growing up, who look up and want to someday get in the middle class. So when we talk about affordability, whether it's income taxes, property taxes, healthcare, how much college costs, how much access to childcare, that's what we have been attacking from moment one. And I would say, by the way, and this is also a fact, my opponent has said that he supports President Trump's policies. President Trump is the one and his party who pushed through the cap on the state and local tax deduction, which is the biggest tax increase on middle-class families in the history of our state.
A $10,000 cap.
You betcha.
What has that done, Governor, to the state of New Jersey, particularly homeowners?
I think its impact, Steve, has been masked by the pandemic. Now, first we saw the census results and all these folks who said there are moving vans up and down the state and people are leaving. Guess what? It turns out some of those moving vans were bringing people in and our population grew substantially. Secondly, since the pandemic, even more so, as you know, and you and I have talked about it, you've had an outmigration from that vertical urban living and working reality into going to suburbs, and New Jersey has been a big winner in that respect. So I think those trends, or that trend in particular, has masked the hurt that middle-class homeowners, particularly our seniors. You know, someone said at one point not that long ago that the SALT cap, lifting the SALT cap would help wealthy homeowners only. My answer was, that person who said that hasn't been to New Jersey. This is overwhelmingly a middle-class homeowner, especially senior middle-class homeowner tax increase. And again, it was brought by President Trump, supported by my opponent. It's crystal clear. We got to undo that. I'm going to fight to get that cap lifted if it kills me, which it might.
I'm Miles, and this is what I work for. To be my best for them and for me, in body and in mind. I need a health insurer that helps me get the care I need for both. That has mental health professionals that I can talk to when I need to. Because when I feel strong and secure, so do they. This is my life. And this is how Horizon Blue Cross Blue Shield of New Jersey works for me.
Also brought to you by Hackensack Meridian Health. Keep getting better. Horizon Blue Cross Blue Shield of New Jersey. Here when you need us most, now and always. Operating Engineers, Local 825. Summit Health, a provider of primary, specialty, and urgent care. New Jersey Institute of Technology, NJIT, makes industry-ready professionals in all STEM fields. New Jersey Sharing Network, NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years. the New Jersey Education Association. And by Eastern Atlantic States Regional Council of Carpenters,